Hi, my name is Lorraine Smyth and I'd like to present my project, the COVID Patient Monitoring App. 29th of February 2020, the Health Protection Surveillance Centre confirmed the first case of coronavirus in Ireland. The digital transformation team were tasked with finding solutions that could help with the COVID crisis. We collaborated with a small Irish company, Patient Empower, to redesign their IPF app for use with COVID-19 patients. It was very hard to envisage what kind of numbers we would have of COVID patients presenting in Ireland. At the time, all we had to go on to forecast usage was what was happening in Italy and Europe with COVID. As Eric Topol states, remote monitoring of patients and telehealth solutions became very important in patient management during COVID. Communicating effectively to patients was a key to their usage of the app. We used video platform and written material delivered with the pulse oximeters to explain how to use the system. A big part of communicating to patients is in the listening. It's well documented that patient-centered designed apps are more successful. We contacted patients' advocacy groups, such as cystic fibrosis. We asked their opinions on the app. A big part of that was listening to what they thought we should remove or aspects that we could change within the app to suit their needs. So how does it work? A Bluetooth pulse oximeter will be sent to you by courier. This is linked into the app on your phone. You take your saturation levels 3 times a day using the Bluetooth pulse oximeter. This automatically goes to the app. Your readings will then show up in a portal in a hospital or on the GP's laptop or desktop. If your saturation level drops below 94, this is an indicator that you may be becoming hypoxic. The app will send you a reminder to contact your clinician. It will also send a clinician a reminder that they need to contact you. In the next video, you will see how the app was very useful to Bobby, who is a nurse who contracted COVID.
Hi, I'm Bobby. I'm a social care worker. I was redeployed last year during the first wave of the COVID-19 pandemic. I was redeployed to a residential setting for adults with intellectual disabilities, and unfortunately while I was there I contracted the coronavirus. It was then that I was prescribed the COVID monitoring app. And I have to say that I found it very reassuring to know that there was somebody there that was monitoring my levels at all times. And knowing this actually probably helped me from, or stopped me from going into emergency department a few times over the time that I had it. But even when I did end up in the emergency department, because it was Bluetooth connected to the app, all my levels were there correct, and it meant that I was able to give them a full history of my breathing issues. As the system is new to dealing with people with COVID, I was also able to share my experience and give my opinion on how the app could be adjusted to dealing with people with COVID.
Clinician adoption was very positive. We got great feedback on how useful the app was. It was also very reassuring for patients, and we got very good feedback from patients also. Over 500 GP surgeries use this service in every county, including the Aran Islands. This slide shows figures from Beaumont Hospital on usage. You can see from this slide that we use the app in an agile manner. When we were in the middle of COVID waves, we added in patients with COPD, IPF and CF patients. We wanted to keep patients safe and cared for well in their own home, so we included as many patients as we could to keep them out of hospital but monitored safely at home. We provided this service to over 20 hospitals nationally, some hubs, some Roma communities and some homeless shelters. This was very positive and we had some great feedback from clinicians on the usage. This is some feedback from clinicians and senior management on social media. This is a clinical evaluation done by St. James's Hospital and St. Vincent's Hospital on the use of the app. This is our health economics. It's a cost evaluation based on bed nights. We estimate we've saved over 20 million euro on bed nights. More importantly, for our patients, we had over 400 alerts on the app, so patients had to return for more care. If these patients were not on the app, they may have become hypoxic and not realised. This way, it was safer for patients to be on the app at home. I would like to thank Ross, Cullen and Martin Curley. Just being around Ross and Martin, you learn so much. I would like to thank Rosary Mannion for encouraging me to do this Masters. Also the amazing Annette, who never let me give up on this project or any of the other students give up. And also to my family, who I haven't seen in a year due to the project and the Masters. Thank you for persevering with me.